My research is about person-centred practice, which is about focusing on how we can best meet the needs of patients who are using health and social care services, but also to help staff to work in ways that provide care that is focused on effective relationships with patients who are using those services. The research is important and is needed because of the way that health and social care systems function. These systems are very much designed to be as effective and efficient as they possibly can, which means that they're very focused on evidence and targets and ensuring that people move through the system in the most efficient way possible. Sometimes that can get in the way of meeting people's needs in the way that they want them to be met, which is around how they can receive care and how they can receive services that are focused on their relationships and how those relationships affect them and ensure that they're getting the kind of service that is the one that they want rather than the one that is there for them to use. We know that our research is being used in around 22 countries around the world, where the frameworks that we have developed are being used by healthcare organisations to change the culture of practice to one that is more focused on meeting individual needs of patients and supporting staff to do that in a way that's effective for them also. We have seen evidence of that in relation to how different health systems have adopted our frameworks to integrate a more personalised approach to care in the way that services are delivered, in the way that they are helping staff to learn how to provide care that is more individualised and focused on the person, and helping teams to develop more effective relationships so that they can consistently provide care that is focused on meeting individual need. We're also seeing it being used in universities around the world, where they are restructuring their curricula to educate future health and social care practitioners to change the way they think about what's important in care provision and to think about how they can develop as individual practitioners to support each other in a way that provides consistent care. We have also seen it integrated into policy, where government policies are being shaped around the person-centred framework that we have developed and using the tools and instruments to evaluate the effectiveness of services that are provided. The research that we've been doing very much focuses on helping organisations to change their workplace cultures and to ensure that everyone is able to receive these ways of practicing and that staff are able to engage in them. As we go forward, our ambition is that every organisation embraces these ways of working, that they have the infrastructure and leadership in place to enable all staff to experience how to work in this way, and that we also have the policies and strategies in place that support organisations in providing these kind of services. Alongside that, we are very ambitious about developing a global strategy that ensures organisations have the tools and resources to be able to implement these ways of working, but also that we have a systematic approach to how we evaluate and measure both the implementation of these processes and the outcomes that arise for individuals, teams and organisations. Ultimately, our ambition is that by doing all of this work, that we can ensure that organisations are supporting staff to provide this kind of care and services to patients, and that patients have the kind of outcomes that are focused on meeting their needs as individuals.